Retirement, the golden years, a time to relax, see the world, and enjoy the fruits of your labor. For many seniors, retirement lives up to its promises. They travel, enjoy their hobbies, and spend time with loved ones. But what happens when something unexpected occurs? What happens when the systems we rely on, systems like our healthcare system, become overloaded, unavailable, or simply too expensive to access? For many seniors, this is a grim possibility that can quickly turn those golden years into something far less appealing. Natural disasters, pandemics, economic downturns, and even simple things like car accidents can all disrupt the fragile infrastructure we depend on. In recent years, we've seen these events occur with alarming regularity, and history teaches us that they are likely to become more common, not less. These types of events can overwhelm hospitals and medical facilities, making it difficult or impossible for retirees, especially those with chronic conditions, to receive timely medical care. This is where the concept of medical preparedness comes into play. Medical preparedness is simply the act of being prepared to handle medical emergencies when professional help is not readily available. It's about taking control of your health and well-being, and it's especially important for retirees who may be more vulnerable during times of crisis. For seniors, medical preparedness is more than just a good idea. It can be a matter of life and liberty. The ability to treat minor injuries, manage chronic conditions, and even handle more serious medical situations can make all the difference when help is delayed or unavailable. This knowledge can provide peace of mind, knowing that you have the skills and resources to weather a storm, both literally and figuratively. Being medically prepared doesn't mean you need to become a doctor or nurse overnight. It's about taking small, manageable steps to build up your knowledge, skills, and supplies over time. It's about becoming more self-reliant and less dependent on a system that may not always be there when you need it most. Think of medical preparedness as an insurance policy for your health. Just like you wouldn't go without car insurance, you shouldn't go without having a plan for your health, especially in retirement. This guide will provide you with practical and potentially life-saving information to help you take control of your health and be your own doctor when you have no other choice. In the following sections, we'll cover everything from stocking a first aid kit to managing chronic conditions at home, from treating minor injuries to maintaining overall health and wellness. Our goal is to empower you with the knowledge and confidence you need to face the future with resilience and self-reliance. They say that an ounce of prevention is worth a pound of cure, and nowhere is this truer than in medicine. A well-stocked medicine cabinet is your first line of defense. Start by taking stock of your current medications. Talk to your doctor about getting extra prescriptions filled. Stock up on over-the-counter medications and topical treatments. Consider adding supplements to support overall health. Store all medications properly to ensure their effectiveness. A well-stocked medicine cabinet is essential, but a comprehensive first aid kit is crucial for injuries. Ensure it's portable and well-organized for quick access. Customize your kit with high-quality supplies. Include bandages, gauze, tape, and antiseptic wipes. These are essential for minor injuries. Add antibiotic ointment and sterile gloves. Consider senior-specific items. Compression bandages help with swelling. Instant cold packs provide pain relief. A magnifying glass and flashlight are useful. Include medications like pain relievers. Pain relievers are essential. Antihistamines like Benadryl are crucial. Add a first aid handbook for guidance. It provides step-by-step instructions. Regularly check and replenish your kit. A well-maintained kit is vital for seniors. Beyond Band-Aids, essential medical equipment for home use. A well-stocked first aid kit is essential, but sometimes you need more advanced equipment. Tools like blood pressure monitors and glucose meters are invaluable for managing chronic conditions. Proper use of these tools can significantly enhance your ability to manage your health at home. High blood pressure is a common problem, especially among seniors. Monitoring your blood pressure regularly can help you detect problems early. A blood glucose monitor is essential if you have diabetes. It helps you manage your diabetes and avoid complications. A thermometer is crucial for monitoring your temperature. Fever is often a sign of infection, and early detection is key. A digital thermometer is more accurate and easier to use. Consider a stethoscope if you're comfortable learning how to use it. It can help you detect problems like pneumonia or heart failure. Using medical equipment properly is crucial for accurate readings. Read instructions carefully and ask your doctor or pharmacist for guidance. Knowledge is power. Essential medical skills for every retiree. Having the right supplies and equipment is essential for medical preparedness. Knowing how to use your supplies effectively can make all the difference in an emergency. Many resources are available to help seniors acquire these essential medical skills. Start by taking a basic first aid and CPR course. These courses are widely available through organizations like the American Red Cross and the American Heart Association. You'll learn how to perform CPR, treat choking, control bleeding, and manage other common emergencies. Consider taking a more advanced course, such as a wilderness first aid course or a tactical medicine course. These courses teach advanced first aid techniques for situations where professional medical help may be delayed or unavailable. Don't underestimate the power of self-education. Many excellent books, websites, and online resources are dedicated to teaching medical skills for lay people. Explore topics like wound care, infection prevention, basic medical procedures, and herbal remedies. The more you learn, the more confident and prepared you'll feel in an emergency. Practice makes perfect. Don't wait for an emergency to use your skills. Practice applying bandages, taking blood pressure readings, and using your medical equipment regularly. The more familiar you are with these skills, the better prepared you'll be when it matters most. Remember, medical knowledge is constantly evolving, so it's important to stay up to date. Attend workshops, watch videos, and read articles to expand your knowledge base and refine your skills. By investing time and effort in learning essential medical skills, you can become a more confident, self-reliant, and prepared individual, ready to face whatever challenges life may throw your way. Mastering diabetes management at home. Diabetes requires careful management to prevent complications, monitor blood sugar levels, and adjust treatment accordingly. A blood glucose monitor is your trusted ally. Keep extra batteries for your monitor. Diet plays a critical role in diabetes management. Focus on complex carbs, lean proteins, and healthy fats. Consult your doctor before adjusting medication. Stay vigilant and proactive in managing diabetes. Hypertension or high blood pressure is another prevalent condition among seniors, often dubbed the silent killer due to its lack of obvious symptoms. Uncontrolled hypertension can lead to severe consequences, making it vital to monitor and manage it effectively, even more so when access to healthcare is limited. A home blood pressure monitor is an indispensable tool for tracking your blood pressure. Measure your blood pressure at the same time each day, ideally in the morning and evening, to establish a consistent baseline. Record your readings in a dedicated notebook or logbook, noting any significant fluctuations or patterns. Lifestyle modifications are the cornerstone of hypertension management. Reduce your sodium intake by limiting processed foods, canned goods, and restaurant meals. Engage in regular physical activity, aiming for at least 30 minutes of moderate intensity exercise most days of the week. Stress management plays a crucial role in keeping blood pressure in check. Practice relaxation techniques like deep breathing exercises, meditation, or yoga to alleviate stress and promote a sense of calm. These practices not only benefit your blood pressure, but also contribute to overall well-being. If you're on medication for hypertension, ensure you have an adequate supply. Consult your doctor's instructions or any available medical guidance regarding dosage adjustments during emergencies. Remember, maintaining a healthy lifestyle and closely monitoring your blood pressure can help you stay ahead of this silent killer. Arthritis, a common ailment affecting the joints, can significantly impact mobility and quality of life for seniors. While it may not be life-threatening, managing arthritis pain and inflammation is crucial for maintaining independence and comfort, especially when professional medical care is inaccessible. Gentle exercise is paramount for managing arthritis. Low-impact activities like walking, swimming, or Tai Chi can help improve joint flexibility, reduce stiffness, and strengthen the muscles surrounding the joints. Start slowly and gradually increase the intensity and duration of your exercise routine. Hot and cold therapy can provide significant relief from arthritis pain. Apply a heating pad or warm compress to stiff joints for 20 to 30 minutes at a time. Conversely, use a cold pack or ice wrapped in a towel to reduce inflammation and numb pain in acutely inflamed joints. Over-the-counter pain relievers, such as acetaminophen or ibuprofen, can effectively manage pain and inflammation associated with arthritis. Follow the recommended dosage instructions and consult your doctor if you experience any adverse effects or if your pain persists. Maintaining a healthy weight is crucial for managing arthritis, as excess weight puts added stress on your joints. A balanced diet rich in fruits, vegetables, and whole grains, combined with regular physical activity, can help you achieve and maintain a healthy weight. Heart conditions are a serious concern, especially for seniors. Recognizing the signs and symptoms of a heart attack and knowing how to respond promptly can be life-saving, especially in situations where immediate medical attention is unavailable. Chest pain is a hallmark symptom of a heart attack, often described as a crushing pressure, tightness, or squeezing sensation in the chest. However, not all heart attacks present with classic chest pain. Be aware of other potential symptoms, such as shortness of breath, nausea, lightheadedness, or pain radiating to the arms, jaw, neck, or back. If you suspect a heart attack, time is of the essence. Call emergency services immediately or have someone drive you to the nearest medical facility if possible. While waiting for help to arrive, chew and swallow an aspirin tablet, as aspirin can help thin the blood and potentially limit damage to the heart. Rest and remain calm while awaiting medical attention. Lie down and try to relax, as anxiety and exertion can exacerbate the situation. Loosen any tight clothing and keep a watchful eye on your symptoms, noting any changes or worsening of your condition. Remember, early recognition and prompt action are crucial for improving outcomes in cardiac emergencies. Familiarize yourself with the signs and symptoms of a heart attack and have a plan in place for seeking help immediately. Respiratory distress can be quite alarming, whether it's due to asthma allergies or respiratory infections. Knowing how to manage these difficulties at home is absolutely crucial, especially when medical care isn't immediately available. If you have a history of asthma or allergies, it's essential to maintain an adequate supply of your prescribed medications, such as inhalers or antihistamines. Keep these medications easily accessible and make sure you're familiar with how to use them correctly. For sudden shortness of breath, you can try the pursed lip breathing technique. Inhale slowly through your nose for the count of 2, then exhale slowly through pursed lips, as if you were whistling, for the count of 4. This technique can help slow your breathing rate and improve lung capacity. Creating a steamy environment can also be beneficial. You can take a hot shower or bath, or simply fill a bowl with hot water and lean over it, covering your head with a towel to trap the steam. Inhaling the warm, moist air can help loosen mucus and ease your breathing. Staying hydrated is also important. Drink plenty of fluids, especially water or warm herbal teas. Hydration helps thin the mucus in your airways, making it easier to clear your lungs. It's best to avoid caffeine and alcohol, as they can dehydrate you. Accidents are a part of life. Knowing how to treat wounds is essential, especially for seniors. Stop the bleeding, prevent infection, and promote healing. Apply pressure, clean the wound, and use a bandage. Seek medical attention if needed. In a world where hospitals may not always be readily available, preventing infection becomes paramount. This is especially true for seniors, who can be more vulnerable to infections. Many infections can be prevented with simple hygiene practices. Hand washing is your first line of defense against germs. Wash your hands frequently throughout the day. Use soap and water and scrub for at least 20 seconds. Keeping your environment clean is also vital. Regularly disinfect frequently touched surfaces in your home. Pain is an inevitable part of life, but it can be especially challenging to manage during an emergency. For seniors, effective pain management is essential for maintaining comfort and quality of life. Over-the-counter pain relievers, such as acetaminophen and ibuprofen, can be effective. These medications are generally safe when used as directed. Follow dosage instructions and be aware of potential side effects. For severe pain, prescription medications may be needed. Talk to your doctor about an extra supply of prescription pain medication. Store medications properly and securely. Dispose of expired medications safely. Non-medication approaches can also help manage pain. Heat therapy can relax muscles and relieve stiffness. Cold therapy can reduce inflammation and numb pain. Relaxation techniques, like deep breathing and meditation, can reduce stress and tension. Distraction techniques, such as reading or engaging in a hobby, can also help. Burns are a common household injury that can range in severity from minor to life-threatening. Knowing how to assess and treat burns is crucial. Burns are classified into 3 degrees. First-degree burns affect the outer skin layer. Second-degree burns cause blisters and intense pain. Third-degree burns involve all skin layers and need immediate medical attention. Cool minor burns under running water. Avoid using ice. Apply aloe vera or burn cream. Cover with a sterile bandage. Seek medical attention for severe burns. Fractures and sprains are common injuries among seniors, often causing pain and disability. Knowing how to provide initial support and when to seek medical attention is essential. Suspect a fracture if you experience severe pain, swelling, or deformity. Sprains cause pain, swelling, and instability. Immobilize the injured area immediately. Use a splint to immobilize a suspected fracture. Apply the RICE protocol for sprains: rest, ice, compression, and elevation. Seek medical attention for any suspected fracture or severe sprain. In the realm of medical preparedness, we often focus on bandages, medications, and emergency procedures. However, one of the most potent tools for resilience lies in the food we consume daily. For seniors, maintaining a healthy diet is paramount for boosting immunity, managing chronic conditions, and promoting overall well-being, especially when access to healthcare may be limited. Think of your plate as a canvas for creating a vibrant and resilient body. Fill half of it with colorful fruits and vegetables, each hue representing a unique array of vitamins, minerals, and antioxidants. These nutrients act as powerful allies, strengthening your body's defenses against disease and inflammation. Next, allocate a quarter of your plate to lean protein sources, such as fish, poultry, beans, lentils, or tofu. Protein provides the building blocks for strong muscles, healthy bones, and a robust immune system. Choose lean options to avoid excessive saturated fat, which can contribute to heart disease. Complete your nutritional masterpiece by dedicating the remaining quarter of your plate to whole grains, such as brown rice, quinoa, oats, or whole wheat bread. These complex carbohydrates provide sustained energy, fiber for digestive health, and a wealth of essential nutrients. Limit your intake of processed foods, sugary drinks, and unhealthy fats. These dietary villains can sabotage your health, weakening your immune system and increasing your risk of chronic diseases. By choosing whole, unprocessed foods, you provide your body with the nutrients it needs to thrive, even in the face of adversity. Exercise is essential for seniors, boosting health and resilience. Regular activity strengthens the immune system and improves mood. Find enjoyable activities to stay motivated. Walking and swimming are excellent low-impact options. Strength training maintains muscle mass and bone density. Yoga and Tai Chi improve flexibility and balance. When we think of medical preparedness, we often focus on the physical aspects of health. Mental and emotional well-being are equally crucial, especially during times of uncertainty or crisis. Maintaining a positive outlook, managing stress, and nurturing social connections can significantly impact overall health. Stress can wreak havoc on both our physical and mental health. Chronic stress weakens the immune system and increases the risk of heart disease. Finding healthy coping mechanisms to manage stress is paramount. Mindfulness practices, such as meditation, deep breathing, or yoga, can be incredibly effective. These practices involve focusing on the present moment and cultivating a sense of acceptance. Engaging in activities you enjoy is another powerful way to combat stress. Make time for activities that bring you joy and provide a sense of fulfillment. Don't underestimate the power of laughter. Laughter can lift your spirits, reduce stress, and boost your immune system. Laughter is truly the best medicine for enhancing your mental well-being. Sleep is essential for health, repairing our bodies, and regulating hormones. Seniors should prioritize quality sleep for overall well-being. Establish a regular sleep-wake cycle and create a relaxing bedtime routine. Avoid screens before bed and ensure your bedroom is dark, quiet, and cool. Consult your doctor if you have sleep disturbances. Staying connected. The importance of social interaction for seniors. Humans are inherently social creatures, wired for connection and belonging. Social interaction is not merely a pleasant pastime, it's essential for our mental, emotional, and physical well-being. For seniors, maintaining strong social connections is particularly crucial, especially during times of crisis or isolation. Nurture your existing relationships with family and friends. Make time for regular phone calls, video chats, or in-person visits. Sharing meals together, playing games, or simply engaging in conversation can strengthen bonds and provide a sense of belonging. Seek out opportunities to connect with others who share your interests. Join a book club, volunteer in your community, take a class, or participate in activities offered at your local senior center. Engaging in activities you enjoy with like-minded individuals can foster new friendships and provide a sense of purpose. Don't shy away from technology. Social media platforms, video conferencing apps, and online forums can be valuable tools for staying connected with loved ones near and far, especially if in-person interaction is limited. Embrace these technologies to bridge distances and maintain social connections. If you find yourself feeling isolated or lonely, reach out for help. Many resources are available to support seniors, including counseling services, support groups, and community outreach programs. Don't hesitate to seek professional help if you're struggling to cope with loneliness or isolation. The future of your health in your hands. As we conclude this exploration of survival medicine for retirees, it's important to remember that knowledge is power, and in this case, it's power over your health and well-being, especially in a world where access to traditional healthcare systems may become increasingly challenging. It's about taking control of your health destiny and facing the future with confidence and resilience. We've covered a lot of ground, from stocking your medical arsenal to mastering at-home management of chronic conditions. We've delved into the art of wound care, the importance of infection prevention, and the essentials of pain management. We explored the significance of a healthy lifestyle, incorporating nourishing foods, regular exercise, and stress-reducing techniques into your daily routine. But this is not the end. It's just the beginning of your journey toward greater self-reliance and preparedness. It's about embracing a proactive approach to health, one that empowers you to take charge of your well-being, even in the face of uncertainty. A lifetime of wisdom, a future of self-reliance. Retirement is often seen as a time to slow down, but when it comes to your health, it's time to shift gears and embrace a proactive mindset. You've spent a lifetime accumulating knowledge and experience. Now, it's time to apply that wisdom to safeguarding your health and well-being in a world that's becoming increasingly unpredictable. Remember, medical preparedness is not about becoming a doctor overnight. It's about taking small, manageable steps to build your knowledge, skills, and supplies gradually. It's about becoming more self-reliant, less dependent on a system that may not always be there when you need it most. Think of it as an investment, not just in medical supplies, but an investment in your peace of mind. Knowing that you have the resources and the know-how to handle medical emergencies can alleviate anxiety, empowering you to live your retirement years with greater confidence and freedom. Embrace the challenge, empower yourself. The information presented in this guide is not meant to alarm you, but to empower you. The future may hold unforeseen challenges, but with the right knowledge and preparation, you can face them head-on with resilience and resourcefulness. Don't be afraid to ask for help or guidance along the way. Talk to your doctor, consult with pharmacists, seek out reputable online resources, and connect with other seniors who are also on this path of medical preparedness. Remember, you're not alone in this journey. And most importantly, don't underestimate your own strength and capabilities. You've weathered storms before, and you have the wisdom and resilience to navigate whatever challenges lie ahead. Embrace the challenge, empower yourself with knowledge, and face the future with confidence, knowing that you have the tools and the tenacity to take care of yourself and your loved ones.